Thank you. It's a pleasure to be here and happy to talk about something that's really a lot of fun for me and some patients and some ways we're using the light adjustable lens in our practice that I think you'll find interesting. So what we're talking about today is kind of piloting custom vision solutions for aviation. So for various reasons, we started to acquire some pilots in our practice that have had cataract surgery and with the light adjustable lens. And I thought I'd share a little bit of information about that. And we talk about one of the cases that we had just to kind of illustrate some of those points. Uh, One of the reasons this is dear to my heart is that I was in the Navy in my prior life before an ophthalmologist. I was a flight surgeon in the Navy for 3 years before I did my ophthalmology residency. And during that time, I was assigned to the Fighter Weapons School squadron, or better known as Top Gun, and got a chance to fly quite a bit for 3 years, and also had the opportunity to get to know the world of aviation a little bit, how pilots think, what's important to them, and what are the sort of things that they hold dear. And probably of all of the things that you could think of, the one thing that they hold the most dear is their vision. And fighter pilots need to have excellent vision in order to have that job, and they need to keep that excellent vision. So as pilots, as they go through life, they're constantly thinking about their vision, how well they see, what threats to their vision there might be. Cataracts and all those sorts of things are always, a potential thing that could end their career. And so vision for pilots is just one of the utmost important things that they're sensing. And so when we take care of those patients, it's important to keep that in mind. And they're a little different, and so it's important to kind of see that. And we'll go through a few things here just to kind of illustrate that. So kind of as I mentioned, it's a high stress environment, it's a unique environment, and pilots require really high tuned vision in order to perform at their peak level. And they know that, and any little thing that changes their vision, they're going to be aware of, and it's going to create concern for them. If we look at just what some of the regulations are, and I'm going to go into this in a little bit more detail in a moment, but pilots need to be able to see 20/20 in order to maintain their flight status. That can be correctable to 20/20, or it can be 20/20 without glasses, but they do need to have that. And so it's important that that's present for them. They also have some requirements at near as well. Some people don't realize that, but it's not just distance vision that they have to be able to pass a certain vision level at. They need to be able to see 20/40 at 16 inches. And for older pilots, it's also recognized that intermediate vision is disappearing in those individuals as well. So there's a flight vision requirement if you're over 50 years of age, that at 32 inches, you need to have 20/40 vision corrected or uncorrected. So kind of issues there that are important to keep in mind. Other things that are important in the flight environment, glare, contrast sensitivity, all these things are critical in the ability for a pilot to perform his duties. Certainly nighttime vision is as well as critical. The night is a challenging environment for all of us, but in aviation it can be particularly challenging. It's not the type of environment that you want to have to deal with a lot of glare and halos and things like that. So it's important that you have a visual solution that addresses these issues for pilots. And fortunately, the light adjustable lens is something that does that. So I thought maybe what we would do is kind of run through a case and spin some other things through that. And I wanted to start with this gentleman, which is one of the Alaska, one of the commercial pilots that we have in our practice, an Alaska pilot, 56 years old, essentially very healthy individual, very high functioning individual. He noticed over a period of time that his vision was starting to deteriorate a little bit, and he wasn't able to see as clearly as he used to. He's never worn glasses. He's always had excellent vision, wears cheaters to read with, but other than that, that's pretty much it. He wants to have as much spectacle independence as he possibly can have. At this stage, he's unable to pass the vision exam required for him to fly. His best corrected vision is as shown below, 20/30 in the right eye, 20/25 in the left. And that's due to a posterior subcapsular cataract that came on pretty quickly in this gentleman. He was doing fine, and a month later he wasn't. And he's out of no-fly status right now, so he's unable to fly with this scenario present. So it comes into our office and is like, I need you to do something. And so here we are. So we'll come back to him in a few minutes, but let's look at a few other things here that are kind of germane to our discussion. This is just sort of an idea of what the visual environment of a pilot looks like. On the left here, we've got the cockpit, and you can see all the different instrumentation that's present, and all the different distances that those instruments are at. And I've put a little information here about each one, and you can see some are at 40 centimeters, some are at 50. They vary from different distances. And what I didn't put in here is when a pilot's sitting there, he also has a little knee board on his lap that's like an iPad that has approach maps and other different things there. So he's also looking at something like that. So it's a very complex visual environment for somebody to have. And then on the picture on the right here is just an example of what the nighttime vision looks like for a pilot landing a commercial airplane in a metropolitan area. You can see again, that's a very visually challenging environment. Lots of different lighting systems going on here, and every one of them is critical. The pilot has to be able to read all those instruments. Not only that, he's got to be able to look out the windscreen and see the airport properly and have the runway lights not be confusing and all those different things. So you add all that together, and it's a really complex vision environment that a lot of our patients otherwise don't really have to deal with. And I think that's what's important. So they're different, and if you walk away with anything from this, it's just understanding the really unique demands that a pilot has flying the aircraft when it comes to their vision. I'm sorry. So that's where the light adjustable lens comes into play. And prior to this, the best thing we could really do is a monovision lens and have a patient, wear glasses to be able to get their sharpest vision to be able to see this different. And you saw that picture before. To get all of those different ranges, you can imagine that's a complex glasses prescription to try and fill in all those gaps. That's something that's hard to do. And so now we have a technology available to us now that can address some of these issues and allows us to look at some of these things. You have a very high quality lens, and we're going to talk a little bit about kind of what it's classified by the FAA. That's an important issue here as well. But we have a very high quality lens. It delivers LASIK level refractive outcomes, crystal clear, it's a silicone optic, and we have pretty much a wide group of patients that can accept this type of lens. And we have the ability to customize. And that comes into play with these patients. And that's something that you just can't do with another lens. And this lens can do that. So if we look now, we'll go back to our patient and kind of where we're at with him. So we decided we're going to do cataract surgery. The light adjustable lens is going to be our choice. That's going to work well for this gentleman. He wished to have as much range as he could have, but he wanted to maintain 20/20 uncorrected visual acuity. That was he wanted to be able to read the eye chart at the medical examiner's office and see the 20/20 line, but he also wanted to have as much range as he possibly could get at the same time. And so that was our goal. And he mentioned this to me, and this is important here, is that when he talked to the airline flight surgeon, and all the airlines have a flight surgeon, when he told him he had cataracts and was going to have cataract surgery, he was told by the flight surgeon that he would be grounded for 90 days. It would be 90 days. He had mentioned to him that I'm getting a special type of lens, and it's a lens that's going to help me to see in different ranges. Well, the flight surgeon automatically just went to, this is a multifocal lens in their mind. And we'll discuss that in a moment. But so he told our patient that he would be grounded for 90 days. It would be 90 days before he could fly again. So let's talk a little bit about the flight requirements that the FAA has for pilots. So there's different medical certificates that you have to have in order to operate in the aviation world. A first class medical certificate is what all commercial pilots must carry. They must hold that, must be active. It has to be renewed every year. If you don't have a first class medical certificate, you are not allowed to pilot a commercial aircraft. There's a second class, which is a little bit restricted. If you're a co-pilot in a commercial airline or flight crew, you can have a second class medical certificate, and that's fine. It has a little bit less requirements as far as vision and that goes. A third-class medical certificate is what most private pilots carry. That's what most private pilots have. There's a basic medical certificate also that I didn't list here, and that's for if you're just doing very basic recreational flying, you're not flying with additional passengers, daylight visual flight rules only, that sort of thing. But most private pilots have a third-class certificate. Here, as I mentioned, a first-class certificate may return to flying after cataract surgery for a monofocal lens, and here's the key, and this is where the light adjustable lens comes into play. A monofocal lens, once that pilot has achieved 20/20 vision, either uncorrected or corrected, once they have 20/20 vision, they're able to return to flight status. They can fly an airplane again. If you have a multifocal or an accommodating, and this was a throw back for crystal lens, when the crystal lens was being used a lot, and it's not really an issue now, but at that time, if you had a multifocal lens or a crystal lens, you had to wait 90 days before you could go back to flying, and you had to pass a flight physical at that time. And sometimes that, depending on the airline and depending on the circumstances, that required a check in the cockpit to actually go into the cockpit and actually be able to read certain dials and things like that. So it's kind of onerous and it's an issue, and that had to be scheduled and all these things. So there's a logistics issue that comes into play there. You also had to have, and that's where that evaluation showing refractive stability comes in. You're also important that you don't complain to the flight surgeon of significant halos and glare and other things that could impair your nighttime vision. So if you have a scenario where you have cataract, where the pilot has cataract surgery and then is in a situation where, I don't see very well at night after this surgery, that's going to be a problem. That's not something that they're going to just not look at. So there's definite requirements, and it's important. I think it's important for the surgeon to have a sense of these things as well. It's important to know what kind of restrictions our patients are under. So let's come back to our pilot and see how things have been going with him. So we went ahead and did his surgery. It was uneventful. He did very well. The surgery went smoothly, no problems. We began his light treatments at 3 weeks, and this was our our post-op treatment plan, was to get in his right eye, which was his dominant eye, we wanted to get as much visual sharpness and acuity as we could. So our goal was to achieve plano in that eye. And in his left eye, which was our treatment goal, was to get about a half a diopter, and that's what we were kind of looking at. And I actually had him go to the cockpit of his airplane and recreate that photo I showed you earlier, where we had the different distances of the things. I asked him, I said, measure the things that are the most important that you want to be able to see, and let me see what those are and what the distances is. And then he would come back to the office, and I could take a tape measure and I would string that out. Okay, for that instrument, that's this far away from you. How well can you see it now? What is your visual acuity right now? And using trial lenses to see kind of what dialed in for him. So we spent a fair amount of time deciding where we were going to end up, but that's where we did end up. And one other thing I'd like to backtrack and go over is the one thing I didn't mention, and alluding to a little bit here, is monovision. And what does the FAA think about monovision? And they have an issue with monovision. There have been some documented aviation mishaps where they felt that monovision played a role in the mishap. And so they have a policy regarding monovision. And what that policy is the monovision eye, if cannot be worse than 2200 uncorrected for distance. That's the requirement. So now most monovision is going to fall within that, but that's the rule. So there is something, so keep in mind when you're looking at monovision, you want to make sure you're within that parameter. So anyway, this is what we planned for our gentleman. And let's talk now, we'll come back to how he did. Let's talk a little bit about just the light adjustable lens and some of the results and some of the data that some of you have seen, some may not. This is information from a study that was recently done, 1,100 patients, 126 different sites, all sending data in about how their patients have done with the light adjustable lens. And here you can see some of the results that we have here. Distance correction, binocular uncorrected distance vision in these patients, 88% were 20/20 or better, pretty significant. So very, very good results for this lens. We know that it works well. That's not really a surprise, I think, to the people that are here. And anyone who's been using the light adjustable lens you're seeing this is data from 126 different centers, and our data looks very similar to this, and so does a lot of others. So it's pretty consistent. So let's go back to our pilot and see how he ended up. So final outcome, we really nailed that right eye. We got really good vision on him there. He's 2015 uncorrected in that eye. And that's what he wanted. That was number one. That was goal one, was to have excellent distance vision in his dominant eye, his right eye. We were able to get pretty much right where we wanted to be in his left eye. And this is here what his left eye, but we maintained 20/20 vision for distance in his right eye. So he was still able to see the 20/20 line. That was the other thing he wanted to do. He wanted to be able to go into the flight surgeon's office and look at the vision chart, and with each eye read 20/20 without having to put any kind of correction on. So in the world that he's in, he's saying now, I can see most of those things that I wanted to see without glasses. The things that he brought in and asked me to look at, most of them he can see. He says, I'm fine with most of that. Maybe sometimes at night, depending upon the situation, it's not as good as during the day, but it's workable for him, and he's very happy with that environment that he has. He puts glasses on every now and then. He rarely uses them when he's when he steps out of the cockpit. He rarely, if ever, puts a pair of glasses on. So he's very, very happy with the outcome, and it's the light adjustable lens, the ability to tailor. You can't do this really with any real consistency in a monofocal standard lens. It's just not something we can do. And a patient with a multifocal lens, we have other issues we've got to deal with. For one, he's going to be grounded for 90 days. We were able to get him flying after a couple months, and so he was back in the pilot seat, 2 months after surgery. And I think that's, for him, that was substantial. I had a discussion with him. I'll go back, if we go back and you remember in the slide before, his flight surgeon told him he was going to be down for 90 days. And so I gave the flight surgeon a call, and we discussed the light adjustable lens, and it's not something he was completely aware of. He then went and looked and saw that there was actually something that the airline had information about, but it hadn't quite percolated to him yet. And so we discussed the light adjustable lens, what it is, what it does, why it's really it's classified as a monofocal lens from the standpoint of the FAA. And he was like, this is crazy. I can't imagine, I can't believe you guys are doing what you're doing now. It was just, he's not an ophthalmologist. He's a semi-retired cardiologist that's doing this now. And so it's kind of, for him, it was just, this is amazing technology. He's like, now I know something that I can talk to my pilots about. The guys that come in and have cataracts, and say, hey, there's this technology that's really, really designed for pilots, and here it is, and here's a guy that's doing it. And so, for us, just to kind of summarize that aspect of things, the aviation community is a very tight community. They all know each other, they all talk to each other, they all have flight stories that they like to chat about, and they all talk about their vision. And when we've started doing this now, there's an aggregate of patients that are starting to percolate into our practice. Where I live, Spokane is a hub. Alaska, for example, is their main hub is in Seattle, but Spokane is a more economically feasible place to live. And so a lot of these guys live in Spokane and fly to Seattle. They commute to get into their flight system. And so we have a fair number, and they're coming in, they're starting to come in. There's more guys coming in. The flight surgeon's also a flight surgeon for the civilian community and the private pilots that are in that community, and he sees those people and does their flight exam. And so he's talking to those pilots as well. And now I'm getting different people who come in, crop dusters and people who are doing all kinds of different aviation things, or just flying around for fun. And it's becoming a little bit of a pipeline. And it's fun because my background, as I showed before, is in aviation, and the time I spent with those pilots is some of the greatest days I've ever had. And it's fun to see some of them. A lot of them are ex-military. We like to share our military stories and all that, so it's just fun. It's fun. But the light adjustable lens, I think, is uniquely suited for this. And I think you'll find that if you end up doing these surgeries on some pilots, they're going to be eternally grateful for you restoring their vision, allowing them to do what they love. And pilots are very, very, they love that. It means a lot to them. It's the most important thing in the world. And anything you can do to facilitate that makes you a hero in their eyes. And so and this technology allows us to do that, and I think that's a very special thing. So just kind of in summary, you know, the light adjustable lens, it optimizes the outcomes for the aviation community. It's uniquely suited for that. Customizable solution, and it enhances vision performance and safety. And for me, it's been a practice builder, and it's something that I'm really, really happy to be part of. And very happy to have a sense of sharing some of that with all of you today. So thank you very much.